First MTP joint.
So that one, you'll have a flexor toe, and it's the joint right here.
First metatarsal bone.
That one is the bone right here.
First cuneiform bone.
First cuneiform bone would be right here.
Navicular bone.
Navicular bone is the bone right here. Start here and it goes across right there.
Talar head.
The talar head would be right in here.
And calcaneus.
Calcaneus is the heel bone right here.
Sustentaculum tali.
That would be right here.
And then the spring ligament.
The spring ligament attaches from the sustentaculum tali to the navicular bone, so it's right here.
Tibialis posterior tendon.
The tibialis posterior runs here behind the medial malleolus and down to the navicular.
Flexor digitorum longus tendon.
The flexor digitorum longus are the tendons that run from the 2nd through 5th metatarsals down.
And then flexor hallucis longus.
The hallucis longus goes from the big toe down.
Medial calcaneal tubercle.
The medial calcaneal tubercle is right here.
And then plantar fascia.
Plantar fascia is along the bottom of the foot.
And sesamoid bones.
Sesamoid bones are right in here. They change based on person.
Wow. Fifth metatarsal bone.
Fifth metatarsal bone is right here.
Cuboid bone.
Cuboid is right in here.
Peroneal tubercle.
Peroneal tubercle goes right here.
Peroneus brevis tendon.
Peroneus brevis goes through here and it goes down to the 5th metatarsal.
Peroneus longus tendon.
Peroneus longus goes through here and then goes down through the bottom of the foot over to the 1st metatarsal.
Second and third cuneiform bones.
Second and third cuneiform. So the first right here, second, and then third.
Dome of talus.
Dome of talus is right in here.
Sinus tarsi.
Sinus tarsi is the depression right here.
Extensor digitorum brevis muscle.
Extensor digitorum brevis muscle is the muscle belly right here.
Tibialis anterior tendon.
Tibialis anterior is the tendon right through here that goes to the first cuneiform.
Extensor hallucis longus tendon.
Extensor hallucis longus is the tendon that runs through the big toe.
Extensor digitorum longus tendon.
It's the tendon that goes through the little toes.
And then peroneus tertius.
Peroneus tertius goes down through here and over top of the 5th metatarsal. And now I'm going to test active range of motion of the toe. So the fulcrum goes on the 1st metatarsal joint, and the stationary arm goes back towards the back of the foot, and you'll have the movement arm in line with the toe. I'm going to have her flex her toe to test toe flexion. Go ahead and do that. And hers is at about 40, which is in the normal range of 35 to 45. And then gonna have her do extension. Which is at about 79, so that's in the normal range of 75 to 85. And after active range of motion, we're gonna do passive range of motion. So for toe extension, I'm gonna push up and then flex in. I'm gonna go down, and you can do the same thing with the other metatarsals. So up for extension, down for flexion. And then I'm going to do manual muscle testing. So testing flexion, I'm gonna have you push down against me with your big toe. And then extension, push up. Then for flexion, push down. And then extension, push up against me. There you go. Now after that, we're gonna go into special tests. And the first special test that I'm gonna do is the vagus stress test. So you're gonna grab the big toe around the first metatarsal phalangeal joint, and I'm gonna bend the toe laterally. And if this test is positive, it indicates a MCL sprain. And then I'm gonna do the varus stress test. I'm gonna grab the same joint and I'm going to move the toe medially to the cracked. And then if that test is positive, it'll indicate an LCL sprain. And then after that, I'm gonna go into the inner metatarsal glide test. So I'm gonna grab first metatarsal and the second metatarsal, and they're gonna move opposite. One's gonna go planarly and one's gonna go dorsally. And if this test is positive, it shows that there is a trauma to the deep transverse metatarsal ligament. So after this one, I'm gonna do the tarsal metatarsal test. So you grab the first one, then you're gonna stabilize the second metatarsal, and you're gonna move the first metatarsal dorsally and planarly. And if there's an increased glide, it shows ligamentous laxity. And if there's a decreased glide, that shows there could be joint adhesions or articular changes. So after that, I'm gonna do the mid-tarsal glide test. So that one's up here. I'm gonna stabilize the second tarsal and just move the first plantar and dorsally. And you can do that with the rest of them. And for the same, that's the same thing for this one. If there's an increased glide, it shows ligamentous laxity. If there's a decreased glide, it's joint adhesions or articular changes. So after that, I'm gonna go into the navicular drop test. So you're gonna wanna grab a piece of paper and have the patient rest their foot off the table, and you're gonna wanna measure where the navicular is at when the foot is resting. So I'm gonna put a little measurement on the paper, and then I'm gonna have you swing your leg over and put your foot on the ground with full weight bearing, and measure it again. And hers is the same, but if it drops to more than a 10 millimeter difference, that indicates hyperpronation of the foot. So after that, I'm gonna go into the Tinelstein test, which you will take 2 or 3 fingers and palpate around the posterior tibial nerve, which is in here. And you'll take 2 or 3 fingers and kind of just tap. And if this test is positive, it indicates tarsal tunnel syndrome. So after that, we're gonna do a long bone compression test. So I'm gonna grab this distal end of the bone, and then grab proximal end of the bone, and you compress them together. And if that shows that there's a lot of pain when you do that, that could indicate a metatarsal fracture. So after that, I'm gonna do the interdigital neuroma test, which generally you would test between the 3rd and 4th metatarsal. So you would squeeze those together for a minute or 2, And if there's a lot of pain when you do that and it decreases significantly after the minute or two is up, that indicates a Morton's neuroma. So that was the last special test. So I'm going to go into myotomes and durotomes. So for the L4, it starts up here and crosses the patella and goes down to the first metatarsal. So for the durotome for that, you would take something like this and do sharp and dull. Then they would have to tell you, normally they would have their eyes closed and they would tell you if it was a sharp or dull pain. And then for the myotome for that, you would do ankle dorsiflexion. So I would hold that and you would push against me dorsally. And then for the L5, it starts on the lateral thigh and crosses the patella and goes down in between the first and second metatarsal. So for that one, for the durotome, you would do the same thing, sharp and dull, and have them tell you which one it is. Okay, and then for the S1, you would go from the lateral hamstring and down into the fifth metatarsal, and you would do the same thing, sharp and dull. And then for the myotome testing for that one, you would do ankle plantar flexion. So I would hold it like this and I'd have you push down on my hand. And then for the S2, you would do, it's from the medial hamstring and it goes down through the Achilles, down through the calcaneus. So for that one, you would do sharp and dull for the durotome. And for the myotome, you would do knee flexion. So I would push against her while she brings her knee back, like that. And then the last thing we would do would be reflex testing. So actually you would do the pulse, and then the dorsal pedis pulse would be right there. And then the posterior tibial pulse would be back in here, right there. And then after that, we would go into reflexes. So I would take this, and then for the quadriceps reflex, you would hit it against the patellar tendon. There you go. And then for the Achilles reflex, you would go back behind the Achilles like this. There you go. And that is it.